Thank you, and hi, everybody. I'm Tara Haley. I'm the Health Beat Leader on infectious disease for the Association of Healthcare Journalists. HCJ is the largest organization of health journalists in the US and does not accept funding from any corporate interests. This webinar is one of a series of topic-specific training opportunities to brief health journalists on the latest information in a particular health area and to give you story ideas or resources you can use in your work. A recording of this webinar will be available afterward. Today's topic is a conversation on the cure for everything, where American public health is and where it's headed. The conversation centers on topics covered in the book by today's guests, Michelle Williams, a professor of epidemiology and population health at Stanford University School of Medicine, and former dean of faculty at Harvard T.H. Chan School of Public Health, and Linda Marsa, a former Los Angeles Times reporter and Discover contributing editor who covers medicine, health, and the environment. Their book is The Cure for Everything, the epic struggle for public health and a radical vision for human thriving, which Publishers Weekly recently called an urgent, inspiring vision of what public health can be. We'll put a link in the chat here shortly where you can order the book if you're interested. At the end, I'll see if I can put up a QR code that goes to that link. Today, we'll hear primarily from Dr. Williams about what she feels is the most important for people to know about the development of public health as a field, what it's accomplished throughout history, how attitudes have shifted toward public health over the years, and what challenges we now face, but what's possible in the future. Linda will then give a little bit of a discussion of the co-writing process and how journalists can cover these issues, and what the collaboration was like. After the guests present, we'll answer your questions. You can ask questions at any time by typing them into the Q&A space where the question mark is at the bottom of the Zoom frame, and then I'll direct the questions to our guests. We'll go ahead and get started with Dr. Williams.
Thank you, Tara, and thank you all for sharing your time for this webinar. I also, while I'm thanking people, want to thank my co-author, Linda Marsa. Without her, we wouldn't be able to communicate what I feel so strongly is a misunderstood, an undervalued, and a critically important pillar of civic society. What I'll do is I'll spend a few minutes talking about the scope of public health, but want to share with you that I was inspired to write this book largely as I watched in the middle of the pandemic a population and our country's leadership not really fully appreciate the principles, the scope, and the role that public health played in building modern society. So in writing this book, I really tried to interrogate myself, all of the people in the field of public health, to understand how could our life's work be so poorly understood and poorly valued. And I came to the conclusion that a lot of it has to do with the scope of public health is so broad. The scope of public health has become everything. Linda and I, in the book, borrowed a phrase that public health is everything, everywhere, all at once. Public health is the architecture of modern life and modern society. Public health is a public good upon which all public goods only happen when public health is available to all. Public health is where science and social justice comes together, where good science is brought to scale to solve problems that are constantly changing. So when you think about public health, you think about, the water that you use to brush your teeth this morning and that you'll drink all through the day. You can do that in most parts of the United States without worry of carrying a pathogen with the drink of water. Think about clean air. Clean air, especially today, when we have an administration that puts the value of 0 on human life when calculating the impact of pollution on population health. And vaccinations. Think about the importance of vaccination historically and presently, and the misinformation that threatens the benefits of public health. So I start by trying to describe just how expansive public health is, and I try to uncover the victories and the heroes who sacrificed a lot of their livelihoods and sometimes even their lives in promoting the one true principle of public health, and that is to use science to solve problems and improve the lives of population. We in the book, Linda and I talk about the Great Escape. And here we are trying to tell the story of how modern life is built on an engine that is public health. We also describe how in the 1920s, when medicine became more standardized and there was a tendency towards moving more into the laboratory and the science of bacteriology, there was less of an interest in investing in the infrastructure that saved lives. And that continues to this day, where there's an underinvestment in the infrastructure that allowed us to bring clean water, safe housing, sanitation, and environmental workplace nutrition and vaccine mandates to a place where we in between the 1980s and today increased human longevity by 30 years. And it's well known now that 25 of those 30 years gain in life expectancy is attributable to public health interventions. I want to just say a few words about vaccines. Vaccines are in the news every day for all the wrong reasons, but to remind people that vaccines have saved an estimated 154 million lives over the past 50 years. That, folks, is the equivalent of 6 lives saved every minute. And currently, vaccinations prevent approximately 3.5 to 5 million deaths annually. What I love about Linda's contributions is she adds beautiful words that evoke images that stick with you. And in the book, she writes quite beautifully that if you want evidence, if you want to see the evidence of vaccines in human life, just walk through an old cemetery and you'll find dozens of graves of babies and children who died before the 1950s. After that point, though, however, when vaccine campaigns became part of the public health portfolio, you don't see these tiny headstones that you would see in the old cemeteries. And think about the historic victories of public health, where smallpox, the only human disease ever eradicated, eliminated globally in 1980 because of an eradication campaign, the commitment of people like Bill Foege, for example, who died this past week, where eradication effort and science came together to stop the scourge of smallpox. We can go on about measles and diphtheria and polio, but sadly, folks, the news is a little alarming that we currently have leaders in institutions in the United States that disparage the benefits of measles vaccines and now even alarmingly polio. But it's really important, and we bring forward the statistics in the book that overall 103 million cases of vaccine preventable diseases have been prevented in the US since 1924. And by the way, that's polio. 103 million cases of polio have been prevented since 1984 because of vaccination against polio. We talk quite a bit about maternal mortality, which is very much in the news today because alarmingly, the US, of all wealthy nations, have the highest rates of mortality. The current rate is about 10, greater than tenfold higher than our peer countries of Switzerland and Norway, for example. And the devastating racial disparities can't go unnoticed, with Black American women having maternal mortality rates that are 3.5 to 4 times higher than their white counterparts. I'm here in Bangkok participating in a regional global health conference called the Prince Mahidol Annual Meeting. And in this region, we talk a lot about low-income countries struggling with maternal mortality. But it's important, I think, for Americans to know that although we spend so much money on healthcare, we have the distinction of being the only wealthy country on the World Health Organization's list where we have seen significant increases in maternal mortality since 2000. This is not because of human frailty. This is because of policy failures. We are seeing elevated maternal deaths in states without Medicaid expansion. In fact, in those states without Medicaid expansion, we see maternal death rates that are 18 to up to 50% higher than in those states where expansion occurred. And so the US is really the only country studied without federal guaranteed for um, parental leave, another policy failure that is not pro-natalist. It's actually anti-public health and anti-women's health. Um, Sadly, we cover the devastating story and the impact of gun violence and children's health in the United States. It's known to those of us in the field and maybe to many of you journalists who cover healthcare news that gun violence has been the leading cause of death among children from the ages of 1 to 17. It's been the leading cause of death among children 1 to 17 since the 2020. And annually, we lose about 4,500 kids age 19 and younger to gun violence. 4,550 children were lost in 2023. And again, when you think about disparities, the racial disparities are alarming. Among children, Black children in the United States between the age of 1 to 17, their gun death rates are 18 times higher than white children of the same age group. Here again is where America public health is an outlier, where in the United States, gun violence accounted for 90% of all women killed among 23 high-income states. So not only are we an outlier in child health, child deaths related to guns, but even in women's health, we find that where the 90% of all women killed by guns among 20 high country nations occur in the United States. Linda and I spent quite a lot of time in the book talking about missing Americans, and we are talking here about America's epidemic of early deaths. And here we make the case that the life expectancy for the first time in a century in the US is declining by more than 2.5 years lost in just one decade. And this is an unprecedented drop for a wealthy nation that's driven, and this loss of life expectancy is driven largely by preventable deaths. And again, very alarming because despite spending more on healthcare than any of our peer countries, the US is falling behind. We've dropped to 49th globally in life expectancy, and it's estimated that by 2050, we will drop to 66th in ranking of countries. The missing American phenomena, and I think it's an important descriptor, it indicates that more than 1 million deaths annually would have been prevented if the United States mortality rate were comparable to other wealthy nations. For too long, we have been complacent in comparing life expectancy and death rates among Americans within the American population. But when we look at peer high income countries, we really see that we are falling behind other wealthy nations and have statistics that more or less resemble far poorer countries with less resources committed to health. A core theme of the book is that we can't solve the public health problem with pills and technologies. A core theme is that the root causes of some of the problems that I've quickly just described, those root causes for things like gun violence, maternal mortality, and America's early death crisis all share the common root, and that is the disappearance, the dismantling of community-based health prevention, health promotion, disease prevention, and investment in a public health infrastructure that brought us out of the 1800s into a modern, thriving society. The hope, the optimism that we bring to the work is that we've done this before, where we invested in a workforce, we invested in infrastructure, and we built a nation that was vibrant, that is creative, that is a cultural center for humanity by investing in public health and the people who support the health of communities. Our failure to prioritize public health and prevention and health promotion over curative medicine um, can be addressed if we respond to the crisis in a proactive and equitable way. I want to end on a positive note, and the positive note is that if we invest in the infrastructure and the people, if we see public health not as charity, but as a strategic pillar for development of an economy and civic society, if we recognize that the social determinants of health are drivers of many of the root causes of factors that shorten American lives, we can and will regain the environment where all populations thrive. We have to recognize that investments in public health have large returns. And one example I'll close with is, despite the administration's thought that the science around air pollution control is too uncertain to value human life in the calculations for improving air pollution, I just want to remind everyone, if you look at the facts, the irony here is that since the Clean Air Act was put into place, every dollar spent on reducing particulate pollution returned $77 in health benefits. That's an ROI of 1 to 77. And that happened because a massive policy resulted in preventing 100,000 deaths annually due to air pollution and prevented millions of illnesses and absenteeism from our commercial spaces. So with that, let me end, and hopefully we can get into an interactive conversation. And I would love for my co-author, Linda, to participate. Over
Well,
to you.
if I could just jump in to add some information that we had in the book. One of the things that I found really interesting is that we wrote a whole section on Costa Rica. And Costa Rica is a country that puts public health first. They don't have much money, so they invested it in public health. They have about, what, 1/6 of the kind of investment that we have in public health. But they reduced infant mortality rates to 2%. The whole idea that where you live determines whether your longevity doesn't exist in Costa Rica. The whole idea that infant mortality is based on zip code, it doesn't exist in Costa Rica because everyone has access to health care there. They all have doctors, they all have community health things. And I know, I was in Costa Rica and I reported on it. When women in rural areas are 8 months pregnant, they are taken down to hospitals. I was in Nicoya, which is one of the blue zones, and I met a man who was 99 years old. And when he got leukemia when he was 80, they just put him in the hospital and took care of him. And here's a statistic that will really stun you. Um, Costa Ricans have a much higher longevity than we do. And if a Costa Rican man makes it to age 60, he is the longest lived person on planet Earth. He lives even longer than Japanese men. And this is due to a good public health system. Toilets, sanitation, vaccination, nutrition, and access to health care. Anyway, I'm done.
Sorry, I had to unmute myself there. Thank you very much, both of you. If people have questions, we already have some questions coming in, so I'm gonna look at those here in just a moment. But I wanted to ask a question first. When you talked about the fact that we're living through this decline in life expectancy here in the U.S., how much of that decline? I know a lot of it came about, like the COVID influenced a lot of it, since we lost a whole swath of people then. How much that decline is due to the COVID pandemic? How much is due to gun violence, which is a unique public health problem in the United States? How much is due to chronic disease? And then what are the other causes behind those three? Because those are the three that I happen to be aware of.
Right, right. The decline started before the pandemic.
Okay.
The decline started before the pandemic, and a lot of it, a lot of the good work around discussing the decline is by Linda. You might have to help me with the name Deaton and
Oh,
Case.
yeah, Casey
Angus
Deaton.
Deaton and Ann Case, they're demographers at Princeton, and they started to look at this decline and saw that it was largely because of the hollowing out of primary health care and access to health care to manage chronic diseases like obesity and diabetes. And this was happening in large places where poor rural white Americans were dying at alarming rates from preventable chronic diseases. They focused on white Americans in Appalachia and in the parts of Middle America where we were seeing economic decline and we were seeing the erosion of a primary healthcare system where conditions were not being managed. They described these conditions with the combination of loss of economic activity and loss of economic resources and healthcare as death of despair. So we were seeing these declines even before then. A large part of decline in African American life expectancy are due to two very big things, and you picked out on one, Tara, and that is gun violence. When you have large swaths of young Americans between the ages of 1 and 19 dying, you're going to have a disproportional impact on the life expectancy across the whole lifespan. And so we see a preventable cost of life expectancy disparities largely due to gun violence. But alarmingly, it's also due to the most important health statistic in that we all know, and it's infant mortality. The rate of individuals, children dying under the age of 1 is a perfect metric for how a society takes care of its most vulnerable people. And in the United States, we have a life expectancy, infant mortality rate that is at least twice, if not 3 times higher for Black American newborns than for white American counterparts. And that contributes greatly to the Black disparity in life expectancy.
Well, one thing I
Um,
wanted to add, just a little
Please.
quickie. One of the things that Case and Deaton found, which I found incredibly interesting, is that a lot of these deaths of despair are happening in these Rust Belt areas where there aren't any opportunities and, the jobs have disappeared. And one of the things that they found is that the taproot of a lot of this is a lack of universal health care. Because what happens is because healthcare is employee base, employers are stuck, paying $20,000 a year for healthcare. So this factors into any time they hire somebody. So they don't give them benefits, their jobs are all part-time. And it's also explaining why European countries weathered globalization much better because they were able to pay people more because they weren't saddled with these huge healthcare costs.
Um, this is going to sound a little bit discordant because I'm going to mention something sort of separate from what that we were just discussing. But someone in the question Q&A reminded me of this, and I should have thought to mention it very early on. James mentioned this. We lost two giants of public health this week. So if journalists should be aware of this, I'm sure you guys are aware of this. So the first was Bill Fogarty, who was the architect of the smallpox eradication campaign. I mean, you can thank Bill Fogarty for the fact that we don't have smallpox anywhere on Earth, among other people. But I mean, he was the real lead on that, among many other things. And he continued writing right up until his death. I saw an article just a few years ago from him on criticizing a lot of what was happening with the first Trump administration. But we also lost Alan Hinman, who was Assistant Attorney General and was at the CDC for many years. Hinman is one of those names that's so recognizable to me as someone who works in vaccines that as soon as you see the name on the little author list, you're like, oh, this is going to be good. So I wanted to
Yeah.
mention both of those, Alan Hinman and Bill Fogarty. If you're not familiar with them, they're two huge giants of public health, both in the same week. So um,
Yeah.
another question is, you talked about how Costa Rica invests so heavily in public health and how we didn't. Why did we stop? I mean, you touched on this briefly, but I wondered if you could kind of
Yeah.
dig a little bit more
Yeah.
into it. Why we stopped investing in public health? Like, what the biggest factors were that contributed to the neglect? Dig a little bit more into how that value got lost, I guess. And in the
Yeah.
meantime, while
Yeah.
I'm asking you these questions, I encourage the audience to put questions they have in the Q&A box.
Yeah. Yeah, I'd be happy to start, and then Linda, I'd love for you to chime in because the why is so large.
Okay.
First and foremost, I think when medicine became more standardized, this was after the Flexner report, and I'm going to come back to the Flexner report, but after the Flexner report came through, the report emphasized the importance of standardizing and improving medicine and medical education. But that
This was in
report,
1910, by the way.
this was in 1910, and the report was written by someone who was outside of the healthcare system, who was hired by the Kellogg family to really do a landscaping review of the state of medicine in the United States, which was in a very bad form. It was ascientific, and it really needed to be standardized and improved. Long story short, the Flexner report resulted in an uptick and an improvement in medical education and in the medical infrastructure at the expense of investments in community health and public health infrastructure. The shift in the mindset was to now move towards privatized medicine with pharmacotherapy, grabbing the investments and the resources. And I think by the 1920s, correct me if I'm wrong, Linda, we started to see that the lion's share of dollars spent on healthcare, almost 97% of dollars spent on healthcare went to medicine, leaving only about 3 cents of every dollar on healthcare going to public health. That's not changed since the 1920s. It's the same or if not worse. And during the pandemic, as I, talked to journalists and talked to communities, I tried to help people understand that that shift in the emphasis on the infrastructure of medicine went towards most of our dollars spent for acute medical care and privatized response to illness, as opposed to prevention and community-based actions that support health in a more expansive way. That is and continues to be, I think, the biggest threat to population health. That we have gone from prevention, we've gone from surveillance and prevention, a proactive response to helping populations thrive, to one that is reactive and very costly, and we're not getting the return on investments that we deserve. The other thing I'll say is the Flexner report ended up driving health disparities for Black Americans and white Americans even wider because the Flexner report resulted in the closing of all but two medical schools that serve training of Black physicians. And it closed all nursing schools, if I'm not mistaken. So when we think about a healthcare desert in minority communities, we can trace it back to the 1920s when there was policy and social activities that shut down the training of physicians of color who primarily served communities of color, and that contributed to health disparities.
Yeah, I just want to jump in that, this kind of medicalization of disease really happened with Louis Pasteur and Robert Koch. when we discovered the germ theory of disease, so everybody's going, oh, this is great. Find the germ, cure the disease. So what that meant was that you didn't have to spend millions of dollars on cleaning the air, building new sanitation, all this other stuff. This would be much more cost effective. So I think that, in the late 19th century, we started having this move towards making public health more scientific, and moving away from that community-based model. The other thing that I would add is we have always these ebb and flows in our political environment. And, we had the progressive era with, Teddy Roosevelt. And then in the 20s, there was a backlash against these community health programs, pregnancy programs in the community, vaccination programs, et cetera, et cetera. They were called socialism. And this argument hasn't changed 100 years later. We still are.
Thank you. It's it's disappointing and frustrating.
Yes.
You just discussed again the huge racial inequalities that have occurred in the abandonment of public health. Um, have we made any progress on reducing them, particularly since awareness of them grew during the pandemic, and or did we improve on them and take a few steps backward again? Or can you give me a sense of like how that, I guess, how that was since the Flexner report, how that was, in like the 80s, like what the trajectory of that's been, and especially given, I know that was a big topic during the pandemic when we saw the huge disparities there. It actually kind of hit the national scene, but I don't know if it's still on people's radar now.
Um,
I mean, aside from the administration trying to pretend like it doesn't exist.
well, I think that's where I want to start. I
Okay.
think we are at risk of having an erasure of our history. And that erasure has direct public health implications. That erasure results in, a tub on its own bottom kind of mentality and drives Americans who are not well aware of the social determinants of health to blame populations that have been dispossessed and deprived of economic opportunities, to blame them for their own ill health outcomes, to blame them of their personal choices. And I think we are taking a step backwards that not only um, drives health disparities wider on a racial lens, but it also drives health disparities wider on a social class lens. Um, and we see this through the lens of um, the kinds of distractions that are brought up by these health forward health influencers who are focusing on individual determinants of health without recognizing that it's, housing inequity, economic inequity, poor access to quality education that are the root driving causes of health disparities in the United States. And that these disparities are not only racial, but are also based on class. So I would argue we're moving steps backwards. There are moments, though, of optimism. In the height of the pandemic, when we were concerned that African Americans were not going to avail themselves of the life-saving COVID-19 vaccines, there was a concerted effort by some public health heroes, including one of my own hero, Anthony Fauci, who who went out and did shoe leather public health work by going into Black and brown communities and going into churches. I mean, I was in Boston and he was in, Dorchester Presbyterian Church. He was in Roxbury churches. And people were stunned that this national leader of public health, a voice that, the administration then tried to silence, was making the effort to reach out directly to communities to talk about the importance of vaccines and to own and to hold accountable the public health services of the United States mistakes of the past. And so he reckoned with past failures of the public health service. And I'm speaking about the Tuskegee trials that still live very much in the minds of African Americans.
Yeah,
And
I'm gonna
we
interrupt real quick.
didn't.
I'm very familiar with Tuskegee, and many other people are, but just in case some of our audience members are not, can you briefly mention what that is?
Yes, well, this was a horrific episode in American Public Health Service history where researchers at the CDC wanted to understand the life course impacts of syphilis infection on populations. And they recruited poor African American men to participate in a longitudinal follow-up study of men who had syphilis and were not treated for syphilis, even when treatment became available. And this study went on until the 1970s when a whistleblower shared the story with the media, with journalists, and journalists uncovered this injustice. And it wasn't until Bill Clinton's administration that an apology to the families that survived this dark history in American public health um, apologized to the families. And a good friend of mine, the former Bill Jenkins, another public health hero, a CDC expert, was given the resources to compensate the families that had been damaged by this period in history. But that history of Black Americans being mistreated by the U.S. Public Health Service lives today in the imagination of Americans. And that history contributed to an increased rate of vaccine hesitancy and and skepticism in the public health services response and reactions to crises. And so, um, it was people like Anthony Fauci who understood that history, who understood the implications of vaccine hesitancy in the height of the pandemic, and said the way to counter this was to go into communities and to speak to the skepticism and to answer people's questions, not call them names and not berate people for being skeptical about vaccines, but being honest and clear and communicating at the best possible level, meeting people where they are so that vaccine uptake would happen. And ironically, vaccine acceptance was higher for a while in the United States among Black Americans than they were among white Americans, particularly white Americans who are affiliated with the Republican Party. And again, that was because of misinformation that they were getting from their own leaders that they followed.
I just want to add one little thing about housing. Housing and, where you live and place is such a determinant of your health. And throughout history, Blacks and also other marginalized communities have been forced to live in just absolutely the worst areas. And part of it has to do with zoning regulations and also with stuff that happened. This is a perfect example of unintended consequences. In 1935, under the New Deal, they started doing mortgages so people could buy houses, but they would redline the areas where Black people lived because they were quote unquote, not good, loan applications. And even though we have had fair housing and all kinds of laws to repeal this, patterns, housing patterns have become just absolutely hardened. And I just want to use one little example from right down the street from where I live here in LA. The Baldwin Hills are known as Black Hollywood. And you have, I remember Tina Turner, John Singleton, a lot of very famous, prominent Black Americans live in the Baldwin Hills. They're really beautiful, has a panoramic view of the South Bay, et cetera, et cetera. However, the Baldwin Hills are built over the Inglewood oil fields. And every decade, they try and build power plants there, and other types of things that the community scuttles. But the point is that even Tina Turner has to live in inferior housing. So I thought that was a really interesting example.
That's a great example. And I just want to add a current, when we think about headwinds to public health, we think about the importance of climate change and extreme heat events.
Right.
And again, because of redlining and because of the lack or the underinvestment in Black communities, there are fewer green spaces. So when you think about the impact of climate change and extreme weather events, Black communities with fewer green spaces, fewer investment in parks and recreation spaces are at much higher risk for a current and future threat to population health, still because of the legacy of redlining and underinvestment in Black and Brown communities.
And this topic is actually a segue to one of our questions in our Q&A here. Can you talk about the eugenics movement and how it affected public health? I think a lot of people don't realize, I'm going to throw this little historical fact out there because it feels relevant these days. A lot of people don't realize that Germany in the 1930s got a lot of their ideas from the US. It wasn't the other way around. It was the
That's
US
right.
that inspired Germany, and both with our eugenics movement and with the Jim Crow laws. And interestingly, if you dig into that history, the U.S. was too radical for the Nazis in the beginning. I think a lot of people don't know that either. So can you talk about how that's influenced public health, that history?
Linda, do you want to start?
Well, I just think, and Liz, thank you. That's an excellent question about eugenics because I mean, and this idea really sort of persists, is that the reason that people are sick is because they're somehow inferior, and it's okay to sort of let these things happen because you're thinning the herd, which is a lot of this, but one of our chapters is devoted to the work of W.E.B. Du Bois. And he went into Philadelphia in 1899. And what he showed is that the reason that Black people in Philadelphia had much higher rates of, chronic diseases, lower longevity, et cetera, had nothing to do with them being inferior. It had to do with the fact that they were living in substandard conditions, no sanitary, no access to food, no access to decent jobs, 20 people living in a one room and then latrines out in the courtyard, et cetera, et cetera. You get the picture. A lot of this stuff hasn't changed, but I think that that's part of where the eugenics movement plays a role. And it's an attitude that persists, that somehow these people are inferior and let them die out.
Sadly, there's a news story this past week of um, investigators with an agenda to support the eugenics argument got access to data from a large cohort of children in the US. It's called the ABCD study. And these investigators, the story I think was published in the New York Times. These are investigators are reported to be analyzing the data in ways to document racial differences in IQ. And so you sort of have this replay of the eugenics agenda being brought forward still in the thread of some of America's history in health. We cited Harriet Washington's medical apartheid quite frequently in the book because part of this was a way to justify and to I would say normalize the the enslavement of Black people. And it's a combination of eugenics, but also the political and economic drive to justify exploiting populations. And it persists.
Another question along the same lines from Esther. She said she was intrigued by your point about the Flexner report, the standard, which did you explain that? I want to make sure I missed it. Do people know did you mention what that was when you were describing it?
Yes, that the Flexner
Okay.
report was commissioned by the Kellogg
Okay.
family to
Yeah.
improve the state of medicine and medical care in the United States.
Okay. But in doing so, it meant the closing of a lot of colleges that were considered inferior, that included a lot of, Black students. So that standardization of medicine and medical education led to the shift of privatized healthcare, as you mentioned. How does evidence-based medicine, as we think of it today, and private insurance fit into that landscape? Like how do those intersect?
That's a really good question. And it brings to mind Don Berwick, and we talk about Don Berwick's vision of triple aim, where we've not stayed on the path of embracing evidence-based medicine. We've not stayed on the path of supporting primary health care, which would cause for improved population health management of these chronic diseases like diabetes, hypertension, obesity, violence. And by not investing in those, we end up spending more money on acute care management in for-profit health systems, and in doing so, lose the opportunity to have the returns of improved population health. So I think the point is we've gotten to a place where the medicalization of health has become reactive in acute care, absorbing all of the resources, where more resource sparing public health and primary health care interventions would not only be less costly to families and to health care systems, but would also allow for people to thrive and be more involved in the economic engine that drives this country.
How do you see some of the proposed rollbacks of the EPA that have happened, the EPA regulations? How will they impact public health? And that's a question from Liz, but I'm going to add on to it. My husband and I often talk about the impact of clean air regulations on preventing deaths. And I know you mentioned that there was just a rollback. Yeah. And we
Yeah,
were talking about the fact that there's going to be thousands more people who are now going to die, but no one's going to know that they died because of that. So that part of
right.
this question also might be, what should journalists be doing to make people aware of this? But if you could
Yeah.
elaborate on tell about a bit more about that and about the other impacts.
Yeah. So the Clean Air Act came about because of exquisite research that was done by investigators at the Harvard T.H. Chan School of Public Health, where I was formerly the dean. Frank Spicer and colleagues, over 50 years ago, ran what was called the Sixth City Study. And that brought forward original evidence that showed that air pollution caused premature death and morbidity. And those findings have been corroborated by thousands of studies over the last 5 decades. But just last week or the week before, the current administration, decided that the science was too uncertain to put a value of human life on air pollution. And so they were going to take that value, that calculation of human life, out of the EPA calculation for air pollution policy changes. There could be nothing further from the truth. The evidence is there, and the evidence is there in terms of health outcomes. 100,000 deaths a year have been avoided because of the cleanup of particulate matters, PM 2.5 and ozone, the two deadliest air pollutants. 100,000 lives saved as a result of the cleaning of the Clean Air Act. Incredibly, we also, when you do the health economics analyses, you find that for every dollar spent on implementing the Clean Air Act, the US saved $77 in lost revenue due to absenteeism, and acute respiratory illnesses due to air pollution. So we have a complete false misinformation that's provided around the importance and the significance of the evidence showing how the Clean Air Act has saved lives and promoted economic uh, development, to now the administration arguing that the science is not there, it's not evident, and so they've zeroed out human life in the calculation of clean air.
I just want to add one thing for us reporting as journalists. The climate's changing, temperatures are rising, so that the particulate matter and smog is going to become more dangerous. So we're going to see more deaths, not less deaths from bad air.
And related to
Um,
that, oh, go ahead, Michelle.
I just want to say, this isn't this isn't the first time where government has put corporate profits over population health. In the book, we tell the story of how the workplace, there was a struggle. We had a struggle in improving the workplace of people working in the garment district. The shirt waist, Linda, remind me the
Triangle
triangle shirt
shirtwaist.
Right. Yeah.
Yeah.
fires. The idea was to provide a safe environment for seamstress to do their work was too costly. So, just have these fire trap sweatshops. And it wasn't until a massive loss of life before we started to see policy come into place to protect and promote workers. We saw this in the middle of the pandemic when meat packers were forced to work because they were essential workers, but put in harm's way in poorly ventilated workspaces that contributed to a higher morbidity and mortality rate among meat packers. So this isn't new that we've had administrations that prioritize corporate profit over population health. And one of the things that I hope people get from this book is that we have to appreciate history matters. A lot of what we are seeing and experiencing now, you will see through the chapters of our book that this isn't new. We have been experiencing these kinds of indifference to human life, to population health, to public health for a very long time, for as long as the
Yeah.
history of the country.
It's
I just
interesting.
want to jump in. 8% of all COVID infections during the early part of the pandemic were traced back to meatpacking plants.
Wow.
Hey, that's a study. I mean, I'm not
Yeah.
just making this up. The other piece is the Triangle Shirtwaist Factory fire happened in 1911, and there was a young woman having tea with her friends nearby, and she ran out to watch it. And as she watched, the bodies jumping out to escape the flames, and they'd rather die on the sidewalk than, escape the flames, was a woman by the name of Frances Perkins, who
Perkins.
became FDR's labor secretary, and she was the architect of the New Deal. And she has often said that the New Deal was born on March 1911.
Um, Ellen mentions in the questions, and I wish I had thought of this, the fact that related to the Clean Air Act and air pollution, that the large data centers that are being built for Gen A are kicking out that PM 2.5.
Yes.
And it seems like not a lot of people are talking about it. So many people are talking about AI. It seems like that would be a rich area for journalists to explore it for story ideas and the ways that AI and the data centers being built for it are affecting public health. We've seen stories on public health impact of using the AI chat box for mental health things, but I don't think
Yes.
we've seen the other side of that. So that would be something people could explore.
Yeah,
Um,
Tara, that's a great point. And I want to say, in the book, we try to cover how public health threats evolve over times. I think the important thing that journalists can do is to keep an eye out on those mega trends. Keep an eye out on those mega trends because almost everything new in our ecosystem will have some immediate or downstream impact on the environments in which we live, we work, we age, we play, we're born in. And so, I think, a trained public health person, like a trained journalist, should be saying, if this changes in our ecosystem, what are the likely downstream changes? And what we're experiencing with AI is exactly the kind of mega trend and headwinds that we could face if we're not proactive, we're not appreciating the fact that we could have a syndemic of climate change, aging population, and now energy hungry, water hungry AI technologies.
we have a little bit of time left here, but I want to ask two questions. I'm going to let you know what they both are so that you can leave time for the second one. So the question for Linda is if you could talk about the co-writing process and what that collaboration was like for any journalists who might be interested in it. And then I also wanted to, I'm going to combine a question I had with a question from Liz that I'd like us to end on. And we may have time for one more after that, but I'm not sure. Um, with everything that's happening in public health and everything that happened this year with the Doge cuts and the massive cuts in funding overall, the losses in research, the dismantling of vaccine infrastructure, it's hard not to get despondent. And I'm wondering what's giving you hope right now for that, and whether you think the US can recover its leadership role in public health, and how long it might take to build that retrust with experts in public health. So I'm going to ask the question of Linda first about the collaboration, but I want us to leave time for that other question.
Well, I was very fortunate. Michelle and I ended up being, kismet, and she's going to get so tired of hearing this, but, turned out we went to the same high school. But I always found that really interesting because place is such a determinant. And as we were working, we found that we have pretty much of the same sensibility, although she's a lot calmer than I am because I'm a hothead, as we have established, and stuff. So it was a very nice collaboration, and we really work well together. And it was just a real blessing for me, as a journalist, to be able to work with this material, work with somebody who was so brilliant and lovely, and all that other stuff. But I wanted to talk just a teeny bit about to my fellow journalists. Um, I've written two books before this, and the book, the publishing environment has changed dramatically. And, people just really are reading. And, I really like to write books. It's the thing I like to do best. I really enjoy that. So, how do you do that? And for a while, publishers were giving these big advances to influencers. And then they found out that people who follow influencers don't really read. So they weren't really buying books. But one of the traditional avenues of books that has continued is experts writing books. And a lot of experts really don't know how to write books, so they'll team up with people like us. And I was very fortunate to find somebody who I really enjoyed working with. But they'll team up with people like us to help them write the book. And, just a little bit of advice that I would give people is, in your research, if you want to write a book and you're interviewing a researcher that's doing some really interesting, groundbreaking work, I mean, maybe that's a possibility for collaboration. And I just want to draw your attention to a book called The Crack in Creation, Gene Editing and the Unthinkable Power to Control Evolution. And this is written by Jennifer Doudna and Samuel Green Steinberg, and obviously this was about CRISPR. And then another book was by Catalin Carrico, who, of course, is a brilliant Nobel Prize winning scientist who went through just horrible barriers to get the messenger RNA platform that saved hundreds of thousands of lives. So it's breaking through my life in science. So these are just examples of books that were written by breakthrough technologies where, obviously there was a collaboration. So it's just sort of an example, but I was very fortunate because Michelle and I really work well together and I really enjoyed it. But it's just something for journalists to think about.
So we're right at the hour, but I think it's worth going a few minutes over just to get it's such an important question to talk about what gives you hope right now. We all need that, and whether you think we can recover. Will we return to being leaders in public health, and what will it take to regain that? But I guess also the expertise with the brain drain, but the trust.
Yeah, yeah. Let me just say, for me, the writing process was very precious, and the most gratifying thing that I hear from we were writing this book in the middle of the pandemic. We've spent maybe only 12 hours together in the same room. We've done this all virtually. But I have to say, the best thing that, in addition to gaining a new friend in life, with teaming with Linda on this book, was when people say, I picked up this book and I expected it to be another science book, but it turned out to be a page turner. I've published 500 research articles, but nothing with the beautiful prose that a talented journalist like Linda could bring, which really adds the human face to the story, and it's just so readable and enjoyable. And I know I couldn't do this without collaboration with a great talented journalist. So I publicly thank Linda for this every
Thank you.
time. She probably gets tired of hearing this.
No,
What gives me
not
hope?
ever.
I've spent my entire career as an educator and a researcher in public health. And when I saw the numbers of admissions, applications to public health school double and triple during the pandemic, I knew that we were finally reaching a population we might not have been reaching before because we were in the middle of a crisis and people started to say, what is this public health? And yes, we're in the middle of a crisis, but I want to be a part of a team that tries to do its best. And at our best, what we in public health do is to create the conditions for humans to thrive. And when humans thrive, societies thrive, economics thrives. And we saw in the middle of a pandemic young people, middle-aged people running towards the profession of public health because they understood the value of investing in creating the conditions where human can thrive. That gives me hope. Now, there are moments where I despair, like 2 weeks ago when we saw the administration abandoning the principles of health promotion and disease prevention with dismantling the EPA's Clean Air Act. Moments of despair when data start to disappear that support and promote investment in public health. But at the same time, again, I have optimism because there are past, current, and future public health heroes who are out there doing everything possible to work against the current administration's dismantling of institutions like the CDC, dismantling, leaving the WHO. I could despair in that, but I could also take optimism in knowing that good people everywhere are moving towards the one common thing that brings public health to the fore, and that is a commitment to creating the conditions for people to thrive. Linda talked about the success stories of Costa Rica. It's not rocket science. We just have to invest in institutions and people who serve other people, particularly those most vulnerable. And if we, with this book, can communicate the one true thing, that a threat anywhere is a threat to everyone, if we can really embody that and know that there are heroes out there trying to mitigate those threats, then I think we'll see public health get back to the heydays when we were investing in people and infrastructure that saved lives on scale.
So it sounds like you do think we can eventually regain our leadership role at some point.
We can and we must. I think if we are successful in all of us communicating the importance of public health, we will have increased awareness of our collective vulnerability in the lack of support of public health. And I think with that awareness, we should have people making the right decisions in the choices of their leadership so that legislation and financing are put forward in ways they were done in the past and can be done again to support and promote health for everyone.
Well, thank you very much. I'm going
Thank
to
you.
briefly share, as I promised, this, let's see here, make sure I have it. The QR code. Hopefully you guys can see that. This is the QR code if you want to see their book. I'm going to leave that up for just a quick moment and then I'm going to stop sharing. Thank you both
Thank you.
for telling us about the book, giving us a little bit of hope and history and perspective. Thank you to all of you who tuned in today. If you joined us late, you'll find the recording of this webinar at healthjournalism.org in just a few hours. If you want a transcript of it, you can click through to YouTube and YouTube generates an automatic transcript. And once again, I want to thank you guys, our presenters,
Thank you.
Michelle, Linda, for taking the time to share your expertise. HCJ will continue to bring webinars on a variety of of health topics. It's a perk of membership, and the public is always welcome as well. Thank you for joining us, everybody. Good luck on your story.
Thank you. Thank you.
Thank you, Tara.